Hello, everyone, and welcome to the midterm review. So for the midterm exam, there's 64 questions. It's worth 200 points. There's multiple choice, select all that apply, matching, and fill in the blank. There are a lot of questions that are actually going to cover hypertensive disorders and diabetes. So make sure that you're really focusing on those topics. So you want to look at prevention and care measures. So no examples of primary, secondary, and tertiary prevention and the meaning of each. Review the differences in patient-centered care, case management, primary care, and family-centered care. Fetal heart rate monitoring. So you need to know basic fetal heart rate terms. So for the fetal assessment, you want to know the baseline, variability, accelerations, and decelerations. And you want to make sure that you understand the meaning of each deceleration. What is the etiology? So look at your VLCHOP acronym and make sure that you know that. Be prepared to recognize tachysystole in the management. Understand contraction terminology, so frequency, duration, resting tone, and how they are assessed and documented for both internal and external monitoring. What does variability mean and what could each one represent? What might the patient complain about if the variability is minimal or absent? You need to be able to make this connection between what the patient is reporting and what you're seeing on the fetal monitor. Same thing applies for fetal movement. What would you expect to see if you have a very active fetus? How do you determine if the decelerations are recurrent? So remember, we talked about this in fetal monitoring. Okay, it's 50% of what you're looking at. If you have a strip and you have 5 contractions on that strip and 3 of those contractions, there's a deceleration present that's greater than 50%. So that's going to be a recurrent deceleration. Prenatal labs. Make sure that you understand what all the prenatal labs are for and the timing that we do the labs. Okay, so you need to understand that. Most are done in the first trimester. Some are repeated again in the second or to early third trimester. Okay, so make sure you're looking at that. Know when GBS is collected and what we do it for and what we do with the woman who is GBS positive. Ultrasounds and prenatal screening and genetics. Also fetal circulation. So be sure you understand the ultrasounds performed in pregnancy, the timing and the purpose. Generally, there's going to be 3 ultrasounds done. 1 in the first trimester, 1 at 12 weeks to do the fetal genetic screening markers, and then again the anatomy scan at 18 to 20 weeks. They may get a growth ultrasound later depending on if there's complications. However, they'll minimally get those 3 ultrasounds. So make sure that you understand that they get 3 and what we do at each one. Understand trisomy 21, autosomal recessive disorders, and how we screen for them. Okay, know the difference between screening and diagnostic testing. Understand each of the 3 fetal shunts and approximately when each one closes. I really want you to more focus on where they are in relationship to the fetal heart and anatomy. Also, the ductus venosus, that's not going to be located in the fetal heart, but understand, what leads to the closure of the ductus venosus. Discomforts of pregnancy and antepartum care. So make sure you're reviewing the immunizations in pregnancy, which ones are recommended and which ones do we avoid in pregnant women. Diet in pregnancy, be sure to review food safety, foods to avoid, kind of dietary teaching in pregnancy, the necessary nutrients that they need, review possible mineral deficiencies that can occur in pregnancy. Okay, so we discussed all of those in the lectures. Understand the presumptive, probable, and positive signs of pregnancy. Review the discomforts of pregnancy. So back discomfort, carpal tunnel phenomenon, varicose veins, nausea and vomiting, leg cramps. The book also talks about these, and you can look in there to see some other common discomforts. So just make sure that you're looking at those and understand the management for those conditions. Complications in pregnancy. So review preterm labor. What are the signs, presentation, management? Include ruling out preterm contractions versus preterm labor. We also talked about the fetal fibronectin test. When do we collect that? When do we avoid collecting it, or when do we just not use it because it's contraindicated? Okay, so remember, the patient can't have had intercourse or any vaginal exams or penetration in the 24 hours prior to collecting a fetal fibronectin, or it's going to have a false positive result. The management of preterm premature rupture of membranes. Okay, so what do we do for these patients? Okay, a lot of times it's going to be very dependent on if they're actively contracting, if they're bleeding, all of those kind of things. So make sure that you understand. And it's important to remember that, is your patient in a critical situation? Okay, are they bleeding out? If they're actively bleeding out, okay, with a condition, they're going to get delivered. We're not going to waste time and blood loss to try to get this patient under control. Okay, you have to look at the urgency of the situation to depend on what the management is going to be. And as a nurse, you have to be able to anticipate that, okay? Review correlation of ruptured membranes and complications that may be related to it, okay? So prolonged rupture of membranes, again, carries the highest risk of infection. The longer a patient's ruptured without being delivered, the more likely it is that she'll develop an infection, okay? And this can become serious. Review pre-existing medical conditions and implications. So I want you to specifically look at asthma, cardiac disease, anemia, herpes. What are the possible implications to the fetus? Placenta previa, presentation. How would you expect the patient to come in? Nursing management, implications of bleeding associated with previa. Okay, again, if you have a patient emergency bleeding, okay, and they're not stopping, they're gushing out blood, they're going to be delivered, okay? Rather than someone that might come in, they may have like a slow trickle of blood, they may have some blood on their pad, but they're not actively bleeding. That's a patient that we might be able to stop, give steroids, prolong the pregnancy a little bit longer if she's preterm, and see what happens. But you have to look at the urgency of the situation to anticipate what's going to happen. Anaphylactoid syndrome of pregnancy, we didn't talk about that yet, so don't worry about it. It won't be on the midterm. Okay, complications in pregnancy. So again, review preeclampsia. Make sure you know each hypertensive disorder and how it presents. Make sure that you understand interpreting lab values. What's the lab workup? What's the type of labs that we're going to order? And again, as a nurse, you have to anticipate what's going to be ordered for the patient. What is your interventions for a patient with preeclampsia? Magnesium sulfate, make sure you understand the purpose, the signs of toxicity, and the side effects. And again, there's differences. Make sure you're able to differentiate what's toxicity and what's just a side effect that we watch. Know the names of the medications used. You don't have to know the dosages, but I do want you to know we use labetalol, hydralazine, nifedipine. Okay, those are some of the medications that we use to manage blood pressure. Those are about the only medications we use. Okay, so it's those three that you need to know. GDM, risk factors, management, testing, timing and method of testing, implications of the mother and the fetus. Okay, and remember, the mainstay of treatment here is going to be diet control. Okay, so I can't emphasize that enough, that if they're not following the diet plan, they're not going to be in good control, okay? So make sure you just go back to the basics and understand that. Understand what the management is and what's the best approach for the patient. Placental abruption, most common reason, presentation, management. Again, it's important that you understand the causes. Okay, we talked about the main cause being hypertension. Okay, but sometimes they can have both hypertension and they just did a line of cocaine and they came in. It's important really to make sure that you get the patient's history. What is going on? Do they have a history of drug use? Okay, that's an important question to ask these patients. We have a fair number of pregnant patients that abuse drugs, and that's important to know. Twins, which type carries more complications? Okay, that's really the basics about twins that you have to know. Cervical incompetence, what's the management of that? All right, labor, know the stages of labor and what occurs in each stage. True labor versus false labor. How are you going to know a patient's in active labor versus latent labor? The P's of labor. Okay, make sure that you're familiar with each type. Pelvic types, the most ideal, least ideal for a vaginal birth. Dilation, effacement, station, and presentation. You don't really have to know about artificial cervical ripening agents, but what I do want you to know is remember the prostaglandin and how we talked about the inflammation at the level of the cervix and how they have bloody show due to cervical ripening. Okay, so make sure that you understand that and review it. Labor pain management, so pharmacologic versus non-pharmacologic methods, and then what are some side effects from pain management, specifically the epidural. All right, and that's going to cover the midterm. And if you guys have any questions, please reach out. I will go ahead and post when the Q&A will be for the midterm review. But make sure that you're studying every part of this slideshow. If you guys have any questions, please ask me an email. Thank you.